my client is going to give a lesson on why sometimes people with hypermobility, they have an injury that actually causes hypomobility. And part of the road to recovery is restoring normal movement where it was blocked.
Yes. So before coming to the Hesch Institute, I would think in my mind that having EDS or being hypermobile means that I'm completely extra flexible and my injuries are because I'm overextending and having too much movement. But what we found is that when you have hypermobility, you're actually stuck in certain positions because the injury causes hypomobility. So if this is my wrist and I'm doing a spring test on my wrist and I am pushing it until the motion stops, so I'm pulling up the slack, in somebody that's normal and not hypermobile, they could just pull up the slack and spring it. But when you're somebody that has elastic tissue or cartilage, you have to spring it, hold it for 10 seconds,
Load it. You have to load it. Take up the
load
slack.
it, take up the slack for 10 seconds. And then we found that when we go to spring it, then it's actually blocked.
If you have an injury,
If you, right.
in certain directions. Carry on. Forgive me.
Yes. So if it's blocked, because that's what's causing the pain. So then he treats it to restore movement by doing whatever, by putting more pressure on the joint, right?
Yeah, we use a fulcrum on the joint. It's a specific technique in a specific direction, and it might be very similar to the direction of the spring test, or it might be different from that.
Right.
But the treatment, as you say, is a gentle force applied for a long time.
Yes.
A long time meaning at least 2 minutes.
Yes. So I found that some of the corrections that he was when he was pulling up the slack and doing the spring test, I didn't realize that a lot of what was happening in my body that was causing so much pain is because it was actually hypomobile because it was stuck. And so that was something I think I learned coming here that's different than what I had thought before I came.
And sometimes it's the joint right above or the connective tissue
Yes.
that's symptomatic where motion is blocked.
Yes.
So yeah, that's how it works.
Yes.
And just to clarify, taking up the slack is moving a structure such as your wrist, such as bending your wrist back all the way to where it stops moving. And then at that point, that's where you can test to find out if there might be hypomobility in which it doesn't spring, or if it's normal, it springs and it bounces right back with integrity, or if it's hypermobile, then it will spring, but it'll be boggy in the recoil. It'll be less abrupt.
Yes.
In the recoil. So in my method of treating joints in the body with a person who is hypermobile, if I find one direction in which the joint moves too much, then I test the opposite direction. If they are hypo in the opposite direction, then it's easy to restore that movement and it actually creates a balanced joint. Right. And then you go back and you retest the other direction and it's like, oh, now they have normal mobility in both directions. So what I'm trying to communicate with this population, I'm trying to conquer this old mythology that I'm hypermobile, I injured, the joint hurts, therefore it moves too much.
Right.
And that's causing a lot of harm because people are not getting effective treatment.
Or the treatment that we're getting works very temporarily, but then it just goes back. And then it releases, but it goes back because it's not something that is actually correcting the problem. It's almost just putting like a Band-Aid on it temporarily.
So how, using this system, I found you clearly have hypermobility syndrome. We know that.
Yeah.
You have EDS.
Yes.
Okay. And I found hypomobilities at several parts. I found it in your jaw, your upper neck, your pelvis, your hip. Where else?
Yeah.
Where else?
My ilium, my rib.
Yeah, your rib, your eighth rib. Yes, indeed.
Yes.
Yeah. So we were then able to restore normal mobility. And what did that, how do you feel in response to us restoring mobility?
I would say the biggest thing that I didn't even realize was a problem was definitely my jaw, because I've had jaw pain for years, and I always feel like it's kind of stuck on one side, or I get ear pain. And when Jerry released it, it's like, even just chewing gum right now, it's not like click, 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 like it was actually stuck. And it's almost like for the first time, I feel like my ears opened up and I feel like I can move my jaw for the first time in a really long time. So I didn't even realize, because I thought my jaw was just moving too much as opposed to not moving at all. So I found that really interesting.
Very good. Very good. So yeah, what I try to do, I'm training therapists all over the country. I have a whole body course. I have a sacroiliac course. I have a cervical course. But basically, I teach all major joints throughout the body, and I teach using the most gentle method of evaluation of the intrinsic property of a joint, which is once you've taken up the slack, you should be able to spring it, and it should spring forward a little further in that direction, should bounce back with integrity. That's a very important functional property of joint, and very few people evaluate that.
Mm-hmm. I also think that something really important is, if a physical therapist does get trained in the Hesch method and does, whether going to, a conference or just doing the course online, I think it's really important to sort of advertise that as something that the PT has been trained in, because I would say that we are from Maryland and we flew all the way out here because I couldn't find any PT that was trained in Maryland, because the PT has to actually advertise that they know this method, because it's very different than what they might have been learning out of their textbooks or their training. So I think that's really important too.
We're trying to get the word out. We're working very hard. Thank you very much.